And when none of these seem to work, you can depend on aurum arsenicum. Now, you'll be wondering, where from did I dig out this aurum arsenicum, which is not at all a common remedy? Actually, there's hardly any mention of it in any other books. There's nothing in Kent's Materia Medica. Clark Dictionary, which is normally very elaborate and descriptive, and it would run a few pages of any remedy, devotes just one paragraph of this size for the aurum ars. It is mentioned in the Clark. It's only this size paragraph about aurum ars. But what I would like to say is I stumbled upon this in the course of looking for blood pressure as well as stroke heart remedies. And I stumbled upon this and I found it very interesting and worked on it for almost half my lifetime. 25, 30 years I worked on that. And I feel it has got a great application. And mind you, the aurum has got with the greatest affinity to the heart, and arsenicum has got the greatest affinity to whole circulatory system and the nervous system as a whole. So when those two combine, it becomes really a formidable remedy. I should say all these indications are developed by me over the years. As I said, there is a lot of self-reproach, self-criticism, irritable, depressed, turbulent, obstinate and irascible, affections disturbed with weak heart, not hurt, heart, I'm sorry, can't stand least contradiction, desires open air, but cold drafts cause pain, rheumatic affections and swelling of joints, strange vascularity all over, edema with vascular fullness, violent flushes of heat, pain in the back of head, occipital headache, pain in all over the body, purple face like lachesis, retrosternal pain, strawberry nose, hard enlarged liver, effort syndrome. That is, they are perfectly all right, but the minute they exert, they become dyspneic and either they get pain or become breathless. I've generally employed aurum ars in 200 potency. In acute conditions such as a coronary thrombosis, I dissolve 2 globules of aurum ars 200 in a cup of water and give it in small sips every 10 minutes or 5 minutes or 2 minutes 10 times, then watch the progress of the case. Generally, the patient feels better, the color is regained, excessive perspiration stops, breathing more rhythmic, and the pulse regains better volume and tension. So, apart from arsenicum album, even aurum ars has been very, very useful in dealing with acute MI, a myocardial infarction. Watch the patient for a few hours, and if he is getting uncomfortable, repeat another 10 doses at 10 minutes interval. With this, he is decidedly better. The lung signs, are, if any, also clear up. Then I wait for 6 hours and give 1 dose of sulfur. The next day, the patient will look a picture of health, and all the investigatory parameters, and in this case, the ECG also shows remarkable improvement.